Now I'm going to demonstrate how to insert the implant or the Jadelle, Implanon or Jadelle in the female arm. So first of all, you have to make the position. The position for the patient, there should be non-dominant arm of the patient. If I am a right-handed, I will use my left arm. So left arm, there should be the flexion at the elbow and arm should be externally rotated. The position of the arm when the patient is lying down is like that. You can see here is the flexion and arm is externally rotated. On the inner side of the non-dominant arm, you have to palpate the medial epicondyle of the humerus. I am palpating and place the four fingers. These four fingers are 8 to 10 centimeter above the medial epicondyle or 3 to 4 inches. Now you have to mark that area. You have to be very careful for that area because you don't have to go deeper down. There is a sulcus between bicep and triceps where the major vessels and nerves are there. So you have to avoid the injury of that nerves. So after that, when you have marked the area, first of all, I will demonstrate what the things are required for the Implanon insertion. One is the reinforcer for the sponge holder. Other is the metallic bowl with the pyridine sponges, swabs, and there is a 1% Fibnocan. There is a band-aid. This is the syringe for insertion of the anesthetic solution. There is a 12 into 12 centimeter sheet with the hole in the center, sterilized glove, Implanon Jadelle, and its rods packet. So these are the things which are required. You can have these gauzes as well if there is a requirement of the pressure dressing. First of all, after taking the informed consent, you have to take the sponge holding forceps and this pyridine swabs, and where you have marked the area 8 to 10 centimeter above the medial epicondyle in the rotatory motion. The first swab you have to do this antisepsis, and then with the second swab from inward to outward in the rotatory motion. After this application of antiseptic, give the time to dry. When it is dry, feel it. It is or ask the female whether she is feeling anything. After that, you have put on the glove. Obviously, you have to place this drape over the patient's arm, only exposing the area where the mark has been placed. So this is the mark which is 8 to 10 centimeter above the medial epicondyle. First of all, I will go for the Implanon. This Implanon having the single rod of 68 milligram of etonogestrel. So first of all, remove its cap, that is the needle cap. Now I will stretch with the index finger of my left hand. I will stretch the skin, making the angle of just 20 degree, and will move inside the arm. Only the grooved portion will go inside. After that, you have to do the tenting of the. I'm doing the tenting. You can see my needle tenting and insert the whole needle. So it should be in the subcutaneous tissue, not the deeper down. Now you have to break the seal, rotate it through 90 degree, and hold it. After that, you don't have to push that inserter. Just the applicator should be moved out. That applicator should be removed, and you have to see there is no rod inside. The rod has been placed under the skin of the patient arm. So now you have to palpate the area and feel the rod. Ask the patient also to feel that rod. So now we have successfully placed with that Implanon. With the Jadelle, the procedure is the same, but there are the two rods. Here we have to make a V. We have marked this area, and you have to make the V of around. This line should be around of 5 centimeter because the length of the rod is around 4 centimeter. This is the Jadelle with trocar and the plunger. With the trocar, in the same way, I will stretch the skin. I will make the angle of 20 degree. Only the grooved portion or the sharp edge is going down, is going inside. Then I will do the tenting and go in the one direction. So you can see the tenting and the needle is going. You have to go up till the second mark, which is near this whiter portion or near the handle. Now I will remove the plunger. After stabilizing it, I will remove the plunger. I will insert the rod, single rod, and I will push it with that. When you feel the resistance at the site of insertion, you have to stabilize it and remove this trocar up till the first mark. You didn't have to remove the whole of the trocar. I have just withdrawn up till the first mark. Now change the direction and go on the second side. You can see there is a tenting, not in the deeper tissue. If you feel resistant, any kind of resistance, you can change the direction as well. Now again, I have gone up till the second mark that is present on the Jadelle. I have removed the plunger, put the second rod. After the putting second rod again, I have put this plunger. When I feel the resistance, after feeling the resistance, I have started to withdraw my trocard, and now I have slowly withdrawn the whole of the Jadelle. Now you can see there is a no rod. Both rod has been placed. Ask the patient. First of all, you have to palpate both the rods. Ask the patient to palpate and apply the band-aid over the incision site. And if there seems to be any kind of bleeding or seems to be, you can apply the pressure dressing over it. Now remove the this dressing sheet and thanks the patient and dispose of this applicator in sharp container, both the applicators in the sharp container, and fill up the card where there is a date of follow-up, and there should be a proper plan of the annual follow-up has to be written on that card. After patient card has to be handed over, patient card has to be handed over to the patient with all the plan written over there. This is all about the implants, Jadelle and the Implanon insertion. Hope you will find this video very useful. Please share any comments.